The threat of COVID-19 is unprecedented. Today, I signed a stay-at-home order for everyone in the state of Hawaii.
Originally, the homeless, they had nowhere to shelter in place, or more importantly, if they tested positive, they had nowhere to quarantine.
With all the closures, outreach workers say people are getting shoveled around like never before, traveling miles just to get the basics.
COVID kind of helped a lot of homeless individuals ask for help. The tourism dried up. There's now no food and no recycling to be dug out of the garbage cans, which is how they survive.
Everyone we're talking to is like, can I get into shelter? Can I get into shelter?
Now the Institute for Human Services is providing people with the necessities needed to shelter in place.
If you have, encampments of positive cases, it's most likely gonna spread out into the community. So if we wouldn't have been able to be out there and help them, it could have been really bad.
Hey, birthday boy, you almost ready to get out? It's okay. We'll get it over with quick. Please spit.
Is that you?
That is me. I know I look so different, huh? We're actually all homeless at this time, and this is actually one of my clients now. You excited for today, Kainoa? All right.
My biggest fear was, I'm a single mom.
But after school, Grand's gonna fly here.
Oh, I wish, baby.
So just bringing something home or getting sick, not being able to be there for my kid.
Grandpa cannot fly here. He wanted to, but he couldn't make it this time with all the coronavirus that we've talked about, the germs. So a lot of people can't take all the trips they want to take.
He can just drive there?
Well, he can't drive here because there's a lot of water in between and there's no road, but he's gonna call.
Hey, birthday boy! Happy birthday!
Love you and hello.
I love you too, buddy. You couldn't talk your mom into taking a day off, huh?
I have tomorrow off with him.
Come on.
Grab your backpack, babe.
My birthday. My birthday tonight.
We go out into the community and we engage with the individuals at their encampments or where they're at in the streets. It can be really challenging to get sleep at night when you're living outside, so never want to wake people up and disturb what little sleep they might be getting. So when I was homeless, I remember outreach specialist Justin reaching out to me and just building rapport with me, and that will forever be embedded in my head because he treated me like another human being. That doesn't happen often when you're living on the streets.
COVID brought in new challenges for all of us. To be honest, I was a little bit scared, but at the same time that there was fear, there was a desire to be a part of the solution. How do we encourage the homeless to continue to practice safety and continue to get services?
Hi, sweetie, how you doing?
I'm about to throw my slippers.
Your slippers, okay. What size shoe you wear? There you go, you're welcome, hon, okay? I'm Cambria, remember I got you the black dress? Don't forget lunch in a couple hours, okay?
With the more mental health and difficult clients, the more you get to know them and just build the rapport, then the more they trust you and listen to your suggestions. And I mean, of course, there's still a few that won't wear a mask, but for the most part, everybody is on board. And I think just having that common denominator with them, like that I have been there, they know that I understand what it's like to be where they are.
Good morning, guys. How are you guys doing today? Good, how are you? I have some hygiene kits for you guys. In here, there's gonna be a roll of toilet paper. There's gonna be hand sanitizer, mask, toothbrush, and some other hygiene stuff. All right. Have you felt like you've had a fever at all over the past 24 hours? No. A new or worsening cough today? Nope. Any shortness of breath or hard time breathing?
You know, one of the most difficult conversations I had was with the outreach team. One of my team members tested positive, I tested positive, and you know, it really changed. I have never been that sick in my life. Asking people to put themselves out there like that, it was kind of stressful. I think we all understood the importance of continuing the work that we do. I think some of the stuff that's really critical is the low rate of infection in the homeless population. And I think that came from our early responses.
Government cut the water supply and locked up bathrooms at parks across Oahu.
So now you have all these houseless individuals with no bathrooms to use. So the outreach team actually got buckets and pool noodles and garbage bags and made makeshift bathrooms and went and distributed them to the homeless.
I have a nurse that can help your leg, okay?
Thank you very much.
Yeah. I want to come find you tomorrow around 12:30. You'll be by the bathroom.
Come on, sister, please help me.
Okay, yes, yeah. If it gets really bad tonight, just go emergency room. They cannot deny you. Okay, I see you tomorrow, okay?
All right.
Okay.
During COVID, we were blessed to get an outreach RN. So if I find my clients in the streets that are due for their medication and she's available, she can even come to them and administer their medication.
When did you fall down?
Like last month sometime.
So that's been an open wound for a month now. Looks like you need some antibiotics, but you can do a FaceTime with the provider and he can prescribe you medications if you guys need.
And so as we continued to do the work, people started to kind of shift and change, and they realized that when we showed up, we were genuinely caring about people's safety and welfare. They became receptive enough to be able to have really long conversations about, hey, okay, this is what I'm experiencing.
So I gotta do both sides.
Why?
Just to make sure I get a good sample. It's all in there, so.
Gotta be fair.
Is it gonna, like, it's gonna go away after, right? Or is it gonna be, like, irritated or?
Probably about after 5 minutes,
Okay.
you'll feel normal.
That's fine.
So take a couple of deep breaths.
Oh, that wasn't too bad.
Okay, good.
We started communicating with people that we would regularly come back and do COVID testing. We'd come back and do COVID screenings, and we really need you folks to let us know if there's symptoms happening so that we can help you. And we were able to help triage them into some of the quarantine sites where people were able to, you know, isolate in a safe space.
All your meals, all your bedding.
And then just bring down your face mask.
And so you're going through radiation or chemo now?
So I finished my chemotherapy.
Where are you staying?
I'm in Helena Beach.
As a homeless provider way out here on the most isolated landmass in the world, Hawaii, we of course were watching very closely to see how other homeless providers were quarantining a very challenging population.
For me, that was the scariest, is seeing the hospitals overfilling, unable to take patients. Knowing our size of hospitals that we have in the state, that could have been a very real probability if we didn't respond appropriately. We are able to take them into the temporary quarantine and isolation center and provide the medical monitoring and medical treatments to ensure their safety and the safety of our community. So we've been really fortunate to be working with our local hospitals. Queens or Straub can identify a patient who's COVID positive and isn't quite meeting their level of care for acute admission, yet they still need some medical monitoring. They'll send them to the temporary quarantine and isolation center. We'll provide that regular check and monitoring, assessing their vitals, ensuring that all their needs are met. And sometimes when their condition does become worse, when they become symptomatic, when they're having difficulty breathing because their lungs are starting to be impacted, we'll send them to the hospitals. They can get those services and then they'll come back. By doing this, we're able to make sure that the hospitals are available for all of the community.
You know, from a public health perspective, what we would do is anything and everything we could to hold people on property, but we do have enough folks who have left AMA. Typically that's related to a methamphetamine addiction. And so we'll do the best we can to offer them medications and other supports to help them to stay put on property. But what does happen when people leave prematurely from the TQIC, we're required by the Department of Health to file a police report. We took an exercise bike up to his unit because he said, I want to exercise. He felt cooped up. And it was so heavy, it was the perfect anchor for his sheets. And so he tied off one end of the sheets and he threw the rest out the window. And there he went.
A rare Department of Health quarantine order that hadn't been used in 2 decades has been issued 5 times this week.
It starts out as a voluntary choice. If the individual breaks isolation or quarantine in a way that the department deems is a danger to the community, then we evaluate the case with our attorney generals, and if it's appropriate, we'll do the order.
So when we do get folks on property who have mental illness, I would say we do a pretty good job of helping to acclimate them and give them the kind of support and face-to-face contacts that they need. They are, after all, alone in an apartment all day, 10 days, 14 days in some cases. And just by virtue of having our hands on them for a minute, for 14 days during their isolation period, we've been able to affect a lot of positive change and support those homeless individuals to think more clearly, to become more linear, and to really avoid that inevitable relapse back to homelessness, back to addiction, and back to mental illness. Probably one of our best outcomes was in the case of our very first admission into our quarantine center. So we got off to a really great start. And the backstory on this lady who was our very first admission, she was very known to our organization. Many of urban Honolulu's chronic homeless folks are very well known to IHS, which has been an advantage for us in running this facility because a lot of them have found their way in here. She tested positive for the COVID virus, and she was our very first individual that we brought in. She's a rugged individualist, always preferred to be outside. Many folks with mental illness are very isolative, and they don't prefer and are often triggered to be in an environment where they're surrounded by a lot of people. But she really took us by surprise. She was adherent to her medications when she came in. She became very comfortable. I will say she did a poor job of keeping her shower curtain on the inside of her shower, and she flooded several of the apartments underneath her, but we were so okay with that because we understood the significance of her choice, to stay put. Fast forward, we were able to activate a housing voucher, which had already been approved for her. It was just a matter of getting her to the place where she could use the voucher, and we did use the voucher. She moved into a transitional housing program in Kapolei. Her case manager now can find her and checks in on her. She gets her nails done, and she does her grocery shopping, and she's doing great, and she's healthy, and she's taking her medicine. Resources that we've actually had at our disposal in this facility and in running this isolation center have made it possible for IHS and many of our partner organizations to have great outcomes. Anytime we house a homeless individual, we make a lot of noise about it. And it's very reinforcing because if you work at IHS, you know how much hard work really goes into that.
So my name is Crystal Asada, and I am the Rapid Rehousing Coordinator for IHS. We provide temporary financial assistance to families, individuals, and households that need either back rent assistance, homeless prevention assistance. So we help with back rent, or if they need help moving into a new place. During COVID, it was a whirlwind of changes.
Have you applied for any other rental assistance before? Do you have a printer, or do you want, you can do it online, directly online, or if you want it printed, I can mail it to you.
So a lot of the clients that we were assisting came from tourism. Tourism is a very big part of our economy, and it really rocked the boat with them, with the uncertainty of when tourism was gonna ever be back to normal. That's usually, that's their first time ever being in that type of situation. So just having that fear of not knowing what to do, or when that time will come.
In regards to the girls, are they still doing distance learning?
I had a mother that spoke about how she was afraid that the electric was going to be cut off and that her kids weren't going to be able to participate in distance learning. It's hard as a mom to, I guess, ever think about, you know, if your kids are ever going to eat. Do they have enough to eat?
And then they confirmed that his rent portion wasn't paid for like a few months already.
Homeless prevention is definitely the most important part of our programs. You want to be able to help them even right before they're about to get evicted. Because of the decrease in income in January, if you can try and ask your worker if they're able to readjust your rent portion, only because, I mean, they would have to take the most recent when you were working, and you weren't working that much in January.
I just don't want you guys to like get eaten alive by these landlords.
I think the most important part about what we're doing is that we are, we're giving people hope. I think that's definitely what our programs are, you know, across the agencies, is what we need to provide right now. We need to provide some kind of hope that this will go away and that we are all here to assist as best as we can.
Aloha, am I speaking? So we currently have a mat open. Okay, so he can come into the facility and then we can do a rapid test and then we can stick him in a triage. So our triage room is those that don't have a negative COVID test within the last 72 hours, that they can come in and stay in there until we can get them tested. All right, bye-bye. My overall job is to oversee the health and safety of the facility. Hey Chris, good morning.
Good morning.
Honey, what's availability today?
We get 1 downstairs, 7 big dorm, 2 small dorm.
Your mask. Put on your mask. When we first had our first initial client that did test positive, everything just stopped right there when he said, okay, I was positive. You know, everything in my head was like, oh my God, what the hell? It's in the shelter.
I had actually heard and read about, you know, some of the outbreaks on the continent. It just went through shelters really quickly, and that there were some significant spread of the disease. You know, I really didn't want that to happen with us.
An outbreak at an Iwilei homeless shelter prompted another round of mass testing today. So far, at least 30 residents are positive for the virus.
I think for me as a nurse, I just felt like as a public health issue, if somebody who's positive goes out there in the community, there's bound to be more people that are going to be infected. And so we did work with the Department of Health and the State Attorney General's office to actually get a court order to quarantine them and have them stay. If you were positive and had been exposed, you were going to stay in the shelter until it was over.
Admissions to the IHS men's facility on Sumner Street were halted last night. The shelter is now being used to quarantine the sick and those who have been exposed.
It was much better, you know, to just create a quarantine center at the shelter and just quarantine the whole shelter itself, so that if anybody was positive, we'd already have them locked down.
We're told COVID-positive patients are being kept on one floor, while those who were potentially exposed to the virus are staying on another. Both areas are being cleaned regularly through a partnership with members of the Hotel Workers Union. Shelter staff and healthcare providers are on site around the clock.
So when we were informed that we're going to go in lockdown, the way we prepared the facility was we put up more hand washing dispensers. We had PPE for our staff, which is the full gown, respirators, the face shields, and the whole bodysuit. We had all of that prepared. We also brought in more TVs for them. We bought cigarettes, we bought in soda, just reassuring them that, even though we're in lockdown, we're here with you. A lot of phone calls I made was to their employers to inform them that, we're in lockdown. They need to quarantine for the next couple weeks. And if you can hold their job, do not penalize them or fire them.
These are some of the most medically frail people in the community. People with heart failure, people with major amputations, major infections. It was critical for the medical community to gather together and pool our resources to address this issue. Overnight, we transformed the shelter into a medical facility. So the Department of Health was an amazing partner throughout all of this. They were by our side the whole way, providing resources. One of them was bringing AMR, an ambulance service, in. They showed up on day one, taking vitals on our clients to see if anybody was changing, because we were starting to see people get very sick. One of our COVID positive patients who is on oxygen is over 70, frail. He coded. He went into cardiac arrest and dropped to the ground. They immediately administered CPR and got him into the ambulance and got him to our nearest hospital. I do not think that gentleman would have survived that incident if we did not have somebody, a team, right there on site.
IHS staff, I think either before they got here or while they're here, actually embrace the fact that life is full of uncertainty and unfairness. And many of them have experienced that themselves. They have lived experience with homelessness. And I think that in itself makes us a little bit stronger. But the level of heart and compassion that people have is incredible. It just astounds me every day. When people go through the lengths that they do to help someone.
So Willie, he was one of my operations staff. He is always one of those big brotherly kind of people.
Another Hawaii resident has died from the virus. This brings the statewide death toll from the pandemic to 47. Today, the Institute for Human Services confirmed the victim was one of its employees, 36-year-old Willie Talamoa.
People who are working on the front lines, in this case, taking care of the homeless and providing direct care where there's a lot of risk, a person can contract the disease and become quite sick.
I was up there with HPD and EMS. They pronounced him dead, and I was like, oh my gosh. It was like I just turned away, and that's when all the emotions came out. A lot of the families, they couldn't understand why we have to continue working, why are we exposing ourselves. If I don't stay, who else is going to do it? Everybody was looking at me towards, hey, if you can stay, we can stay. They were loyal. They didn't want to leave me or leave our clients, because that's what they felt like. Yes, we're in this together. We're not going to abandon anybody. My team actually came together and said, okay, we're going to work through this.
Today, we've officially opened our doors to men who want shelter at Sumner Street.
For the first time in a little over a month, operations have resumed at IHS, and people who need food and a place to stay are being allowed in off the street. Prior to reopening, the shelter went through extensive cleaning. The number of beds was also reduced from 132 down to 68 to ensure everyone's properly distanced.
A lot of our clients had shared with us. We made them feel that we cared because of all the things that we had made them comfortable with, and that's my motivation in itself. Just seeing them smile, no matter what kind of situation there is, they're in, there's still hope.
Ache in a couple hours, but if you just move your arm around, it should be fine. So you got 15-minute wait, okay?
Set me up.
No matter where we come from, we're all in this together, you know. We're all facing this head first. So in order for us to survive this, we need each other, the support.
If we pool our resources, if we work with compassion, we can solve any problem.
COVID brought us together. I think I've seen an enormous amount of courage from the community.
It's hard work, but the rewards are enormous.
Mommy.
Yeah.
I'm about to do this.
Yeah?
I've never had a career where I felt so much purpose behind it.
Yeah, it's like music.
I hope in the future that there will be people whose lives I touch that can help the homeless, just like Justin sparked that inside of me.
Love you.
I think when someone else close to you, you know, or down the street, you know, is sick, we need to care. If we don't care, it's going to come right back to us.
Yeah. You ready? Let's go get you.
I have
one more slide. No, let's go.
COVID has really reminded us how truly connected we are. We're a community, and I don't think it lets us forget that.